Have you ever experienced an itching that becomes unbearable at night? Or noticed tiny rashes spreading through your hands, wrist, or between your fingers? It might not be an allergy. It could be scabies. Yes, it could be scabies. Today, I'll be explaining what scabies is, how people get it, the symptoms to look out for, the best treatment available, and how to stop it from spreading. Yes. So watch this video to the end because I will also share with you the common mistakes people do that makes scabies infestation to keep coming back or keep reoccurring. Let's get started. What is scabies? Scabies is a skin infection caused by a tiny mite, very tiny mite, a microscopic insect like parasite that burrows into the top layer of the skin. These mites are so small that you cannot see them with your eyes, with your physical eyes. Once they get under your skin, they begin to lay eggs. And when they begin to lay eggs, your body will begin to react because it's as if something foreign has entered your skin. So your body reaction to it is what causes the itches and the rashes you experience. Scabies is not caused by poor hygiene. And some people say, it's because this person does not bathe 3 times or 2 times in a day. That is why the person became infested with scabies and all of that. No, scabies is not caused by poor hygiene. Even someone that bathes as many times as possible in a day can still be infested with scabies if they come in contact with someone who is already infected. How is scabies spread? You may be asking, how can I contact or contract scabies? Scabies spreads mainly through prolonged skin contact. You can get it through, number 1, sleeping on the same bed with someone who is already infected. Number 2, you can get it through sexual contact. Number 3, living in a crowded homes. Yes, there's no space. Everyone is managing, is trying to, squeeze one at one corner or the other, and there is prolonged skin contact. You can contract scabies. Number 4, sharing a room for a long period of time. Sharing a room for a long period of time. Less commonly, it can also be spread through shared towel, clothing, or bed sheets, especially if they were recently used by someone who is already infected with scabies. What are the common symptoms of scabies? The common symptom of scabies is usually itching, especially at night. Severe itching, especially at night. Other symptoms include small red bumps or rashes. Number 2, tiny lines or tracks through which the mites burrow or penetrate the skin. Number 3, blisters or sores from scratching. Number 4, thick crusts, C-R-U-S-T-S, thick crusts on the skin in severe cases. Common places affected include between the fingers, wrists, elbows, armpits, around the waist, buttocks, genital area, around the nipples in women. In babies and young children, the scalp, the face, the palms, and even under their feet can be affected as well. Can scabies go away on its own? The answer is no. It cannot go away on its own. Without proper treatment, the mite will continue to multiply. If you don't do anything about it, they will continue to multiply, and the symptoms may last for months longer or even much more longer. Scratching can even break the skin and cause secondary infection, especially bacterial infection. When you begin to scratch because of the effect of the burrowing of the mites under your skin, before you know it, the skin will begin to break. And if care is not taken, there will be secondary infection. While you're trying to curtail the infestation of mites and all that, you find yourself still fighting to treat bacterial infection as a result of too much of scratching, and the skin is now open for germs and bacteria to perch on and enter the body. It can be dangerous. How is scabies diagnosed? How is scabies diagnosed? A healthcare professional can diagnose scabies by examining the skin and asking you of the symptoms you experience. If the symptoms you experience matches the symptoms mostly experienced with the infestation of scabies, then it will be diagnosed to be scabies. Or sometimes the skin can be scraped to be taken to the lab to look for mites or their eggs under the microscope. That is another way scabies might be diagnosed. What are the treatments? The good news is that scabies can be treated successfully. You can use the following to treat or to take care of scabies. Number 1 is permethrin 5% cream. This is the most commonly recommended, especially in Nigeria. Permethrin 5% cream. It can be applied from your neck downwards, all over, everywhere you are feeling the symptoms. In between your fingers, on your legs, all over your body. it can be applied. And you are to leave it overnight. It's mostly applied at night and leave it 8 to 12 hours. Then you wash it off in the morning. You continue for some days. It can be 7 days or it can be more. Number 2, oral ivermectin can also be recommended or prescribed by your doctor, especially for severe scabies, for crusted scabies, for large outbreaks, and also for people who cannot use the creams properly. The dose is normally repeated after 7 to 14 days because the drug does not kill the eggs. Note: do not take ivermectin without medical advice or without your doctor's recommendation. Please take notes. Number 3, medicines for itching can be recommended. Even after the mites are dead, itching can continue for 2 to 4 weeks because the body is still reacting to the dead mites or the dead eggs under the skin. So your healthcare may provide or may recommend antihistamine like loratadine, may recommend calamine lotion, or might recommend mild steroid creams for selected cases. Very important notes. Treat everyone. Yes, if you discover that only your son or your daughter has been infected with scabies, it is very important that everyone in the house must be treated accordingly. One of the biggest reasons scabies comes back is because when one member of the family is infected, the focus is on the person. And when the person is finally treated, after some time, it reoccurs in the same family or in the same household or in the same environment. So like I said, everyone close to that person that have been infected must be treated. Very, very important. If not, because the eggs keep maturing day by day. So when the person infected has received treatment and the person is now okay, there are the eggs that this might have laid already. And because there have been skin contact, these eggs will soon mature. And when they mature, it will begin to spread again. That is why everyone in the household must be treated if one person gets infected. I believe you have noted it now. Another thing you need to note is cleaning of your environment. Very important. On the day treatment starts, especially if you have seen a doctor or a health provider and drugs or creams have been recommended for the treatment, these are the things you must do to avoid reoccurrence, to minimize ineffectiveness of the drug or the cream that have been recommended to you or for your household. Number 1, wash your clothes, all your clothes, pillowcases, bed sheets, towel, sponges, and everything that the person is using plus the one everyone is using in that family. Number 2, dry them properly, preferably using heat. Dry the clothes properly. If there is sun, bring them out under the sun and let them be dried properly before you carry them into your house. Number 3, items that cannot be washed should be sealed in plastic bags for at least 3 days. Items that you cannot wash, you can seal them, use a plastic bag, seal them for at least 3 days. The reason is because these mites and their eggs cannot survive outside the skin for more than 2 or 3 days. Then your mattresses, your sofas, your chairs, you can clean them well, you can disinfect them effectively, and also you can expose them to heat as the case may be. Or you can even use a plastic bag to cover them for 2 to 3 days as well. Common mistake people make when treating scabies. Number 1, stopping treatment early. Because you have started it for maybe 7 days, 5 days, 7 days, 10 days, and the itching stopped, and it has gone, you stop. No, you have to continue extra 7 to 14 days to ensure that the dead mites have been cleared successfully. Number 2, they forget to repeat treatment after 1 week of being treated. Number 3, they treat only themselves. If you are sick in a family and you become infected, it will become a futile engagement if you just treat only yourself, because you still have to treat others afterwards. Number 4, sharing untreated clothes and mattresses and bed sheets and towel with others. Number 5, thinking treatment had failed, especially when itching continues for 2 to 4 weeks. Like I explained, if you have been following in this video, after treatment, the itching can continue for even up to 2 to 4 weeks until it has been resolved, until the dead mites have been totally cleared away from the skin. How can you prevent scabies infestation in your homes, or how can you prevent yourself from being infected with scabies? Number 1, avoid prolonged skin contact with infected individuals until treatment is completed, especially if you are always using the public transport system. Ensure that you wear clothes that gives your skin minimal exposure, because many people are carrying the scabies on their skin without knowing. And if you're always depending on how many hours you spend sitting on the bus, you can be infected while you are there in the bus or in the public transport system. So if you know anyone that is being treated close to you, ensure that you minimize all form of skin contact. Number 2, do not share your towel, your clothing, your beddings with those who are infected. Very important. Number 3, wash your bedding and clothing after treatment. Wash your bedding and clothing after treatment. Very important. Number 4, seek treatment early if symptoms develop. If you start having some symptoms, seek treatment early before the eggs and the mites begin to spread. Before I leave you in this video, my final message is this. Scabies is common, treatable, and nothing to be ashamed of. The earlier you recognize the symptoms and the earlier you treat everyone who has been in contact with you, especially if you are infected, the faster you can prevent the infestation and prevent it from spreading. If you or someone you know has persistent itching that always intensifies at night, especially with rashes in between the fingers and on the wrists, don't ignore it. Visit a health professional today for proper evaluation and diagnosis, and the preferment of treatment will be given by your health professional. If you find this video helpful, please like, share, subscribe, put on the notification button, especially if you're watching on YouTube. And if you're watching on TikTok, on Facebook, and on Instagram, please do well to follow me, repost, share with your friends, put it on your WhatsApp statuses so that your friends can see it. It is very important that, especially now we are in the rainy season, for those of us who are in Nigeria, this subject is very important that we take note. I still remain your pharmacist, Ezekiel Ozumba. See you in my next video. Thank you.